Welcome to the Nursing 411. Today's lesson is on fundamentals of nursing, and it is going to be week one, introduction to nursing. Today's presentation, we will discuss our lesson objectives. Number one, describe the historical development of nursing as a profession. Number two, identify the roles, responsibilities, and scope of practice of nurses. And three, define professional ethics and standards in nursing. The textbook that we will be using for this course is Burton and Smith, Davis Advantage for Fundamentals of Nursing Care, Concepts, Connections, and Skills, 4th edition. So we are going to discuss briefly the history of nursing. Let's go. So, history of nursing. History has been around for quite some time. Initially, male priests and family members were nurses. Later on, women were allowed to go to school and become nurses. And then those nurses traveled to train other nurses. And one of those nurses is the most famous of them all, Florence Nightingale. Next, we are going to identify the roles, responsibilities, and scope of practice of nurses. What are the kinds of nurses out there? So, there are two main kinds. Number one, a licensed practical nurse or a licensed vocational nurse, commonly known as an LPN or an LVN. And then there are registered nurses or an RN. And bonus, there is an advanced practice registered nurse, which we will later get into. An LPN or LVN is an entry level nurse. Typically, this program takes about 1 year to complete. The entry requirements vary from program to program, but usually a high school education is required. And upon successful completion of the program, the student becomes eligible to sit for the National Council Licensure Examination for Practical Nursing or NCLEX PN. Associate's degree nursing, it's an entry level nursing program for registered nurses. Typically, this is offered at community colleges or private schools. There are a few general education classes that are added to the program, and upon successfully completing the program, students qualify to sit for the National Council Licensure Examination for Registered Nursing. With diploma nursing, this program still exists, but it's not very common. This is where nurses get trained in a hospital, and usually the hospitals work closely with local colleges and universities to offer this program. And upon successful completion, the student can sit for the NCLEX RN. Baccalaureate degree or BSN. This is another entry level program that provides entry into nursing. This is a 4 year program, and upon successful completion, the student can sit for the NCLEX RN, and they also earn a BSN. And I just wanted to hit on that as well. The 2 year program or the associate's degree program is known as an ADN program. Let's go back. What are the roles and responsibilities of a nurse? So, for an LPN or LVN, they work within their established scope of practice under the supervision of a physician, dentist, or registered nurse. And they also give direct care to patients and supervise unlicensed personnel. An RN, as I mentioned before, typically completes a 2 year or 4 year program, and they practice within their own established scope of, excuse me, let me rephrase that. A registered nurse works under his or her established scope of practice under the direction of a physician. They typically provide direct care for patients, they can manage departments, they supervise other RNs, including LPNs slash LVNs, and unlicensed personnel. We do have a few honorable mentions for other members on the healthcare team. The medical doctor or doctor of osteopathy or osteopathic medicine is responsible for diagnosing and treating illnesses and diseases and directs the overall care of the patient. Now, I want to make this very clear. An LVN slash LPN cannot give a patient a diagnosis, nor can a registered nurse give a patient a diagnosis. A physician assistant or a PA is employed by a physician or a hospital. They typically work closely with the doctor to assist in directing care for a patient. A nurse practitioner, which many of you may already be familiar with, is a master's prepared registered nurse who has a certified specialty, has a license in a certified specialty that can diagnose illnesses and prescribe medications and treatments. Now, with being a nurse practitioner, the licensure and scope of practice depends and varies from state to state. So look up your state's Nurse Practice Act for your legal scope of practice as a nurse practitioner. What is the scope of practice for nurses? Very important for you to know. Every nurse must know their scope of practice. So you may ask, where do I need to go for that? You would go to your state's Board of Nursing website and you would click whatever kind of nurse you are. So, being an RN or LVN, you would click RN and you would know what your scope of practice is. What that means is that you must know your legal limitations and allowances when practicing in your home state. So you should know what you are legally allowed to do and not to do. What are professional ethics and standards in nursing? Professional ethics include statements that are publicly published demonstrating a profession's expectations for its members. So, for nurses, we have the American Nurses Association, who publishes the profession's professional ethics. Personal ethics are values that individuals have that influence one's decisions and behaviors. A lot of this can be based on culture, background, parts of the world that you live in, religion, spirituality, and several different factors. An ethical dilemma occurs when a nurse faces a decision where there is clearly no right or wrong answer. Professional standards. Nurses have professional standards, and typically that involves advocating for a patient, even over the benefit of the hospital or its personnel. So, with nurses, we are here to support the patient in every step of the way. From what I hear, nursing is the most trusted profession in the world. So, patients do trust you to guide them and lead them in the right way. So, it is part of our responsibility to make sure we educate them completely and advocate for the patient, even if it's something that we don't personally agree with or is not that is completely opposite of their treatment. We are just there to advocate for the patient. The Health Insurance Portability and Accountability Act of 1996, commonly known as HIPAA, was created to maintain the confidentiality of patients by protecting their personal health information. So, as we know, I think it's a very familiar concept. You should not be looking at patient information that you are not allowed to be looking at unless you are caring for the patient. You are not allowed to talk about a patient to another patient, to family members, to a nurse, whoever that is not allowed to have access to that information. And remember, students are also held to the same legal standards as licensed nurses. This also gets students confused because they feel, oh, because I'm not licensed, this doesn't apply to me. Yes, it does. It absolutely does, because that could affect you getting a license if you are violating HIPAA, you're doing things that are not typically part of the scope of practice for nursing. Anything that you shouldn't be doing could legally affect you in the future. So you are, as a student, if you are a nursing student, held to the same legal standards as licensed nurses. More on professional standards. Every licensed nurse is a mandatory reporter. So, what does that mean? Legally, by law, if you are a nurse, if you suspect that a child is being abused, you must report it to the legal authorities. Do you have to have proof? No, only a suspicion. If not, if a nurse does not report the suspicion, the nurse could also be held liable as well. Informed consent is when a patient that is 18 years and older is of sound mind, gives consent to treatment, procedures, and medications. If the patient is incapacitated, then a legal representative makes decisions on behalf of the patient. Typically, this would be a power of attorney, or a patient might have a living will. If a minor ever makes decisions on their own, usually they are emancipated minors, meaning they are legally allowed to make their own decisions without a parent. Advanced directives are written documents that provide guidelines and instructions for a patient to make medical decisions in the event that they cannot. Usually, this involves a power of attorney or a living will. Thanks for joining me on this quick lesson. If you are interested, you can get in a hold of me. Let's Get Social, YouTube, the Nursing 411 Original, Instagram, TikTok at the Nursing 411, and you can email me at the Nursing 411 at gmail.com. It's been a pleasure. I'll see you on the next video.